Okay.
Close the curtain for privacy. I'll wash my hands. I'll wear PPE when I need to. Hi, I'm Ashley. I'm your student nurse. Today I have orders to do a full head to toe assessment on you. Can I have your first name, your last name, and your date of birth?
Mackenzie Fitzgerald, 12/4/96.
Okay, and I'm just going to check your wristband, make sure that's correct, and it is. And do you have any allergies?
Nope.
Okay. Wonderful. The first thing that I'm going to do is start with your head and work my way down. Okay? So I'm going to have to ask you some questions. Do you have any problems seeing?
Mm-mm.
Do you wear any contacts?
Nope.
Do you wear glasses? Have you ever had eye surgery?
Nope.
Okay. Do you have any problems seeing?
Nope.
All right. I'm going to inspect your eyebrows, eyelashes, and eyelids. They all look good to me. And then I'm going to inspect the sclera and the conjunctiva, so if you can pull down and pull up. Good. And I don't see anything wrong with that there. I need this thing. I'm going to assess your pupillary response. Not this. This one.
Mm-hmm.
Ugh. So I'm just going to start out here and bring it in. I'm just looking to see if your eyes dilate and contract. Good. And then I'm going to do it again. And I'm going to bring it like this, and then I'm going to look at the opposite eye. Good. And good. Is that okay?
Mm-hmm.
Great. Oh, the visual fields. So I'm going to do the 6 fields. So just follow my finger. Good. I'm going to bring my finger close. And back. Good. And then I'm going to come out behind you and tell me when you can see my hand.
No. No. No.
Looks funny on there. All right. Let's see. And I'm gonna have to have you read something. Can you read the blood pressure cuff?
Yeah. Welch Allen Flexiport reusable blood pressure cuff.
Good. All right. Awesome. And then I'm gonna now inspect the nose. So I'm gonna make sure that your nose is symmetrical with your face. Which it looks like. I'm not seeing any redness. I'm not seeing discharge. Do you have any problems breathing?
Mm-mm.
Okay. Your color looks good compared to the rest of your skin. So I'm not seeing any signs of alcoholism. Can you close one nostril and breathe out? And the other. Good. So I'm just checking your patency there. And then I'm going to take the light again and I'm going to inspect the inside of your nose. Good, so I'm just looking at the nasal cavities. Okay. Alright, and then I'm going to inspect your mouth. So I'm going to look at the outside of your lips to make sure that there's no discoloration there. And I don't see anything. And then can you pull your lips down? Good, and your lips up. Good. So I'm looking at problems within your gums. And then can you smile? Good, just looking at your teeth, making sure there's no problems there. And then, can you open your mouth and say, ah? Good. And I could take a light too and look back there at your tonsils. Some people might not have tonsils, but you do, so I definitely want to take a look at that. Do you have any problems with it? Okay. Okay, I think that's good there. Let me see. Oh, I want to look at your tongue. So stick your tongue out again. Can you move from side to side? Good. So I'm just making sure that it works. And then I did your tonsils and the oral pharynx. Now I'm going to have to do your lymph nodes. So occipital, postauricular, preauricular, submandibular, submental, superficial, clavicular, postclavicular, and supraclavicular. Good. Next is the ears. Do you have any problem hearing?
Mm-mm.
Do you wear any hearing aids or anything? Do you get a lot of ear infections? Okay, good. So I'm gonna check your auriculars. So I'm gonna check those. Good, and then I'm gonna pull up and back to make sure that everything's fine and feel for any lumps and bumps, which I don't see. Is that okay for you?
Mm-hmm.
Okay. Then I'm gonna inspect the outsides of your ears, making sure that they're symmetrical, that there's no signs of bruising, discoloration, drainage, anything like that, which I don't see. And you said that you don't have any problems, so that's good there. Okay, I'm gonna whisper to you, and I want you to see if you can hear it. Okay.
What am I saying?
Good. All right. Good. So you can hear that.
Mm-hmm.
And then I want to just inspect the inside of your ear canal. Oh man, I took like 12. Where's this one? Oh. Okay. So I'm checking the outside, then I'm going to go in. Oh, my bad.
It's okay.
And look at the tympanic membrane. And same over here. Pull up and back. And good. I'm not seeing a lot of wax or anything in there either, so that's a good sign. Alright, that part's done. Is that okay?
Mm-hmm.
Except for that one little bump? Okay.
Yeah.
Alright, so next I'm going to check your skin. So I'm looking at discoloration, signs of sweating, signs of coldness. So I'm going to feel moisture and anything like that, which I don't see. And you're pink and warm and dry, so that's good. Then I'm going to feel skin turgor, so I'm just going to feel on your hand. Good, and your skin bounced right back, so I don't have any problem with that. Do you have any problems with your skin that you noticed?
Mm-mm.
Okay, so I'm going to check your nails. So I'm just going to look at the nail beds. I want to make sure that they're not spoon shaped because that could be an iron deficiency. The color's good, it's pink, the texture is good. I'm not seeing any problems with the nails like blood under here or bad cuticles, anything like that. While I'm at the nails, I'm going to check the capillary refill. So I'm going to press down on them and check that it's bounced back between 1 to 2 seconds. And then I'm also going to check, I'm checking the toes for the capillary refill as well. Since I'm down here, I'm going to check signs of edema. So I'm going to press on her lower calf and see if there's any pits that form. A +1 would be 2 millimeters, a +2 would be 4 millimeters, and a +3 would be 6 millimeters, +4 would be 8 millimeters, which would be positive signs, but I'm not seeing positive. So that's great. And then I'm gonna also inspect the peripheral veins in the legs and checking for signs of phlebitis, which I don't see. And I'm also gonna check the peripheral veins in the arms and also check for signs of phlebitis, which I also do not see. Then I'm going to have her hold out her arms for me. So I'm just going to look for signs of muscle, like her muscle coordination. So looking for contractures or twitches or imbalance there. But I don't see anything like that. So that is good. Okay, let's see. I did the legs. Did phlebitis. Did capillary refill on the toes. Did the arms. Let's see. I'm gonna help. Joints. Oh, joints. Okay, so you can feel the joints for any tenderness, pain and swelling. So wherever there's joints, you can feel that. Do you have any pain within that when you write or anything? You don't feel it? Okay. And then I'm going to test your muscles and your range of motion. So can you hold out your arms for me? Okay. So I'm going to check the trapezius muscles. So can you shrug up? Good. Hold your arms out, which is going to be your deltoid. Bring your arms in. Let's see, pull, or I'm going to hold here, you push towards me. Biceps.
What are you doing? Sorry, what am I doing?
Biceps and triceps. Can you wiggle your fingers? Can you hold my fingers? And there you go, squeeze, that's gripping them. I'm going to check her hamstrings here. Let's see, so she needs to do, and her wrists. Sorry, I forgot the wrists. So bending and flexing those, which is good. All right, so I can't move the computer, but I'm looking at her hips. I'm gonna bring her hips in and push out. So I'm doing hip abduction and adduction on the hamstrings and the quads. And then I'm gonna also test her ankles and her feet, which are good. All right, so I'm gonna have you stand up for me and turn to the back, yep, like that. And I'm gonna assess your spine so you can, there you go. Scoot back just a little bit. There you go, that's good. So I'm gonna feel for kyphosis, lordosis, or scoliosis, which I don't see anything with that. That's good. Can you take a few steps and then turn around and walk back towards me? So I'm looking at her gait and her posture, which everything for her seems even and good. You can go ahead and sit back down. Good. What else? I did the legs. I did the arms. I had her walk. Neurological assessment. I haven't done that yet. Do you know where you are?
Southwest Tech,
Okay. Do you know what date is?
December 3rd,
Okay. Do you know what time it is?
4:45, 3:45.
Yep. Good. So I'm just checking her LOC there. So that is good. Did your gait? I need to do the. I did the Romberg's test to make sure that nothing was happening there. Did the memory, cranial nerves. So, olfactory, optic, ocular motor, trochlear, trigeminal, abducens, facial, auditory, glossopharyngeal, vagus, hypoglossal. Okay, and most of those we've tested. The one that I just didn't test was having her stick her tongue out and say, ah, and do the gag reflex. So we did that now. Next is a respiratory assessment, and can I borrow yours?
Mhm.
Okay. So to do the respiratory assessment, I'm going to ask her 3 questions. Do you have any problems breathing?
Mm-mm.
Do you use an inhaler?
Mm-mm.
Let's see. Does it run in your family? Any breathing problems in your family?
Nope.
Okay, good. So I'm going to inspect the symmetry of the thorax. So I'm going to make sure that everything is symmetrical and there's no lumps or bumps or any tenderness. Was there any tenderness? Good. Then I'm going to inspect the spinal alignment here of her, again, making sure that everything is in line, which it is. So it's good. I'm not, again, seeing that kyphosis, lordosis, or scoliosis in there. And she said that she doesn't have pain, so that's great. I'm going to also inspect the posterior thorax. So I'm going to stand back here. Can you say 99?
99, 99, 99, 99.
Good. So I'm feeling for that vibration there, like mucus secretions or buildup, because you could feel that. And in the front.
99, 99, 99, 99.
Good. And any problems with that? Good. Okay, so I need to listen to the posterior. Okay. So take a deep breath.
Here, come forward
Oh.
more. There.
And I would have her keep doing a deep breath, but I don't want her to pass out, so. Good. And then you can scoot back just a little bit again, and okay, that looks good there. And then let's see. Okay, and then I need to palpate listen to the front too. So, I want
Tip
to.
out of this chair.
I want to listen to her carotid. So hold your breath. And I'm going to also feel for JVD. Can you swallow? Good. If there was positive JVD, could have her lay back in her bed and raise the head of the bed about 30 degrees, and that should help relieve that there. And then I'm going to listen to the front. Okay, take a deep breath. Good. It sounded good there. Again, I'm just going to palpate the pericardium, which is by the heart. I auscultated the carotid, looked for JVD. So then I'm going to listen again. The pulmonic, Erb's point, tricuspid, mitral, and then S1 is heard up here, S2 is heard under. Okay, and the abdomen. So that's the last part that I have to do now. Oh, I need to do pulses. I almost forgot that part. So you have temporal, carotid, brachial, radial, femoral, popliteal, posterior tibial, and dorsalis pedis. Okay, now it's time for the abdomen. So, I would ask my client or my patient to void first before I do this. It's going to make it easier to actually palpate and see if there's any abnormalities within that. So she's voided and is ready now for me to check. So I would have her laying on her back with her knees slightly flexed to make it easier for that. And then I'm going to feel for, she would be laying down, but for this we can't because there's a mannequin in the bed. But I'm looking for size, symmetry, contour of her body or of the abdomen, and I would ask my client to raise her head a little bit so it tightens it, so I can see and look for bulges or masses that way. And then I'm going to auscultate. Second right here. Auscultate the 4 quadrants. So I don't know if you can see, but I'm going to do the 4 quadrants here. 2, 3, Good. And then I'm gonna come down here and I'm gonna percuss the abdomen. So that, and it's like a little tapping, which is good. And then palpate. So I'm looking to see if there's any tenderness or any problems here. And then if there was tenderness in the abdomen, you'd want to do that part last, wherever she says that it hurts. So do you have any tenderness? And the bowel sounds were good. With the bowel sounds, oh, excuse me, I think if it's positive, you'd want to listen, or absent, you'd want to listen for 5 minutes in that quadrant, just to verify. And then if they're ticklish when you're percussing, you could have the patient put the hand over, or put your hand over the patient's hand and then move it around to feel. And everything was fine. So I think I'm done, and I would document my findings.